that capsaicin is useful in post-herpetic neuralgia. 4 studies were included in this systematic review, and the pain relief was greater in patients who used capsaicin than in patients who used control. There were some sub-systematic reviews. In the first one, they assessed pain relief within first 8 weeks, and the same results were present when they assessed weeks from 2 to 12. And we think that good pain relief is achieved in approximately 10% more patients with high concentration capsaicin than control after a single application, because we applicate the patch with capsaicin once, and the pain relief lasts for several weeks. There are many side effects of capsaicin, and these side effects include local pain, erythema, edema, but most of them are transient and mild to moderate in severity. In the first study of capsaicin in post-herpetic neuralgia, almost all patients, so 99% of patients had adverse event. And in a systematic review, all these side effects were, of course, more common in patients treated with capsaicin than in patients who were treated with placebo. Fortunately, serious, so severe adverse events were as frequent in control group as in treatment group. Another studies were in patients in HIV infection. HIV can cause many disorders of the nervous system, among others HIV-associated neurocognitive disorders, damage to the spinal cord, aseptic meningoencephalitis, myopathies, and several peripheral neuropathies such as Guillain-Barré syndrome or its chronic form, chronic inflammatory demyelinating polyneuropathy, mononeuropathy multiplex, or distal symmetrical polyneuropathy. And the last one, so the distal symmetrical polyneuropathy, is the most commonly reported neurological complication caused by HIV infection. In different studies, its prevalence is up to 2/3 of patients. And there are different causes. This type of polyneuropathy can be caused by the virus itself, or it can be caused by the antiretroviral drugs. A clinical manifestation is as in a typical polyneuropathy, so symptoms usually starts in toes. Patients have bilateral tingling, numbness, then the symptoms gradually spreads proximally in the lower limbs, and in some patients also the upper limbs are involved. In some patients also the weakness may be present in the lower limbs. And this type of polyneuropathy in HIV infection is or may be associated with neuropathic pain in more than a third of patients. And how to treat painful HIV neuropathy? There is no a good treatment. We can discontinue a potentially neurotoxic drug. It's usually stavudine or didanosine or thalidomide. And on the other hand, we may use just symptomatic treatment, so which ameliorate the painful dysesthesias. In first line therapy, we should use gabapentin, and in the second line therapy, we use antidepressants or topical capsaicin. And the first study on capsaicin in painful neuropathy was conducted also in 2008 in 307 patients. So the patch containing 8% capsaicin was applied directly over the painful site, and low in one group, and in the other group, low concentration capsaicin patch was also applied over the painful sites for different times, so from 30 to 90 minutes. And the study, the researchers concluded that the single application provided at least 12 weeks of painful reduction. So the lower part is treatment group. So the pain reduction was higher in the treatment group. There were other studies on capsaicin in painful HIV neuropathy, and there were a systematic review of these several studies, and it was concluded that single application of high concentration capsaicin patch for 30 to 90 minutes provides a significant pain relief in up to 12 weeks. Another type of neuropathy in which capsaicin was studied is painful diabetic neuropathy. Generally speaking, diabetic neuropathy is present in about 50% of patients with diabetes, and 34% of them has painful neuropathic symptoms. There are several forms of diabetic neuropathy. The most common is distal symmetrical polyneuropathy. And how we treat painful diabetic neuropathy? Once again, we use antidepressants, we use gabapentinoids, we may use topical agents such as capsaicin or lidocaine, and there are other possibilities: electrical nerve stimulation, spinal cord stimulation, acupuncture, alpha lipoic acid, and other types of anti-epileptic drugs, so valproic acid and carbamazepine. The largest study on capsaicin in painful diabetic polyneuropathy was published 4 years ago, and the authors applied 8% capsaicin patch over the painful site for 30 minutes. And the treatment, this type of treatment, provided modest pain relief and sleep quality improvements versus placebo patch. Also, this improvement lasted 12 weeks. And how do we use the capsaicin? The capsaicin patch should be applied by a healthcare professional. So we identify the treatment area, then we anesthetize the topical with the topical anesthetic, because capsaicin causes at the beginning burning sensation, pain sensation, itching. So that's the reason why we should use another topical anesthetic drugs to relieve these local symptoms. Then we apply patch with capsaicin. We monitor the patient for when the patch is applied, and then we remove the patch, and then we clean the area with a special gel. Also, capsaicin was shown to be to help patients with a cluster headache. A cluster headache is a type of idiopathic headache in which patients have attacks of severe pain located in